Hello, everybody, and welcome to what I can't believe is actually the 6th weekly webinar being organised by the Global Platform. And as you know, the topic this week is going to be on pensions and social protection. Next slide, please. This is a kind of follow-up. Next slide, please, Lucas. Yeah, thanks. From a seminar that was held, was organised by socialprotection.org, an organisation I'm sure most of you know about, a month ago. It feels a lot longer than a month ago, I have to say, which included some presentations from some of today's speakers and generated a lot of interest. The link I've put there beneath the photograph is to a blog that they did, which I think is a very interesting blog about that meeting. And you can also download the recording if you haven't had enough of us after an hour and a half. Next slide, please. Clearly, over the month since then, the pattern of the pandemic, the epidemiology, has not really followed what we expected. It's not really followed our predictions, and we're seeing some very unusual patterns, particularly in sub-Saharan Africa. And here, as I've done in other webinars, I'm just providing a little bit of contextual information about the status of the pandemic in two countries that we're going to talk about. So in Peru, we can see that, as in other parts of Latin America, the epidemic has started to hit quite hard, that there are already at least 2,500 deaths and probably many more that have gone unreported, and the trend is rising quite fast. In South Africa, and I think this really did confound our expectations, the number of cases and the number of deaths to date has been very, very low. And the main focus, of course, has been on the impact of a very, very authoritarian lockdown policy in that country. But the trend is rising. So clearly, South Africa may not yet be out of the woods. Next slide, please. So given that pensions are, the main focus of public policy for older people, particularly in low and middle income countries, clearly we have to ask, what can pensions do to mitigate the effects of coronavirus? And I guess on one hand, that's pretty obvious. It stands to reason that they can have significant effects on particularly the indirect consequences and hardships generated by policy responses such as lockdowns. And this is a blog from Uganda that we posted on our site just overnight. So a 68-year-old man in rural Uganda, no pension, his business is stopped, and he's feeling a lot of pressure to support family members who are unable to go out to work as they normally do, and real concerns about the sustainability of their existence without some support, without some social protection. So clearly what this demonstrates is that social protection of different kinds, including for older people, is more relevant than ever. Next slide, please. But on the other hand, sometimes collecting a pension and standing in a queue for a long time to pick up a pension can increase older people's exposure to infection to coronavirus. And this is a photograph which is from a blog we published about Argentina in March 2019, where a large number of older people had to queue overnight on a very cold night in Buenos Aires, because the banks had been temporarily shut down and they were the main payment points for pensions in Argentina. So we have to be mindful both of the potential benefits, but also the risks associated with collecting pensions. And these are some of the issues that we're going to be looking at in greater depth today. Next slide, please. So, sorry, that's our housekeeping slide, but I think you've all been in these webinars before. I just love this photograph of an old man doing some ironing. I won't waste any more time on this. Next slide, please. What I would like to do is introduce this week's guest chair, and it's an absolute honour and a delight to be able to welcome Christina Berendt from the International Labour Organization, who's kindly agreed to chair and moderate today's session. She's a leading expert on social protection, and a recent ILO study that she co-authored refers to the gap in social protection for older people, the fact that less than 20% of older persons currently receive a pension. And as we all know, the International Labour Organization is very strongly committed to ending this gap. It was before the coronavirus pandemic, and I guess it is even more so now. So without further ado, I would like to hand over the reins to Christina, who is going to do a great job as our chair and moderator. Over to you, Christina.
Yes, yeah. Thanks a lot, Peter, and hello, good afternoon, good morning, good evening, wherever you are, to everyone. So it's really a pleasure to be with you, and it's great. And I'm amazed that this is already the 6th webinar of that series. So this is really great. And I think the topic of the webinar today is extremely timely, and it's really excellent. Thanks to the initiative of the organizers, we can all come together in this virtual space to discuss about this important topic. And in fact, we have 3 excellent panelists for the session. I mean, you've already seen that in the program. The first speaker is Gabrielle Kelly from the Samson Institute for Aging Research in South Africa, and she's going to talk about guidance for pension provision in times of COVID-19 theory and practice. And the second speaker will be Florian Jurgens. It's also no stranger to you. He's the social protection advisor from HelpAge International, and he's going to talk about income security and social protection for older people in the COVID-19 pandemic. And last but not least, we have Lucas Sempi from the Universidad Católica de San Pablo in Peru and the University of East Anglia in the UK. And he's going to speak about pensions, health, and COVID-19 in Peru. And then I hope we're going to have a very stimulating discussion then at the end of the webinar. And I think we're all going to try to stick to time so that we will have sufficient time for the discussion then afterwards. And it's really a pleasure to be with you in this webinar. Let me just make one kind of just a few very introductory remarks, and don't be afraid. I'm not going to do another presentation. Like, I just got 3 slides to get us started in this discussion. And complementing what Peter already has mentioned, I think we have all seen that with the pandemic and not only the health impact, but also the socioeconomic consequences, they have exposed in a very painful way the vulnerabilities of those who are not adequately protected. And I think this is true in richer countries, this is true in poorer countries, and well, in poorer countries even more so than in richer countries, but the situation is quite diverse in many countries. And I've just to get us started, I've just put in there on the slide a graph which comes from a recent ILO brief, which puts together the different dimensions of vulnerability in one slide with a kind of a regional focus, and showing the impact on employment, showing the prevalence of informality, which is another dimension of vulnerability, and also showing the social protection coverage and the huge gap in social protection that we see. So, I mean, we all know that in addition to the health crisis, the health impact the crisis has had really a devastating impact on unemployment and incomes. And this is obviously even exacerbated for people who are in the informal economy and cannot benefit from the kind of protections that those in the formal economy might have. Not all of them have them to the same extent, but at least many of them do. And what we have seen is that those countries which have already quite strong social protection systems in place, they could relatively quickly scale up the provision to ensure healthcare and income security. But in fact, many low-income countries don't really have these possibilities, and they have very limited fiscal space to do so. So, and this leaves them even more exposed. And I think Florian and also the other speakers are going to talk more about that. And if you can go to the next slide, which gives us a very broad overview. And I know also that Florian is going to talk about this in more detail. So we have seen, and this is the good news about it, I mean, we have seen in many countries, more than 160 countries, have put in place social protection measures quite often on an emergency basis. So, and that has really led to kind of a flurry of initiatives, which is really in some way very good news, because it shows that countries are really valuing the importance of social protection and really recognize that this is an important instrument to keep people going, both with respect to ensuring their access to healthcare, but also ensuring income security. But at the same time, we know that these measures are by far not really sufficient and not adequate to respond to the crisis. And we know that much more is needed actually to respond to the immediate effects of the crisis. But even more so, and with that I come to my last slide to kick off the discussion. If you can go to the next one. Even more so, I mean, what we see is that social protection is really at a crossroads at the moment. I mean, we see that many countries have really stepped up their measures. They have really put in place a lot of the emergency measures, but we don't know whether they're going to stay. We don't know kind of in which direction they're going. There is now a much greater appetite for universal solutions. I mean, especially in times of the crisis. I mean, even the World Bank and the IMF have recognized that there's limit to very targeted and narrow approaches. But at the same time, it's also emphasized quite strongly that this is a temporary measure. And so the question now is really, in which direction are we going into in the future? Are we going into the direction of universal social protection systems that include floors that ensure at least a basic level of protection for all? That really ensure that there is universal coverage for all, but also not only about coverage, but it's also about ensuring that there is comprehensive protection, that the coverage is adequate, that the financing mechanisms are sustainable and equitable, and that the systems are sufficiently adapted to what's happening in the world of work, and that the approach is really based and grounded on human rights and guided by international social security standards. So that would be kind of the positive turn that this could do. But at the same time, we know that there is really also at the same time, I mean, with all the financing that is mobilized, or it's trying to be, I mean, it's not yet there actually. There is a lot pledged at the moment, but it's not yet, it hasn't yet reached those who should be reached. But we also know that there is quite a high risk that this is going to lead us into a context of austerity, which entails quite significant risks when it comes to the question of coverage, the question of whether there will be only minimal benefits with very significant gaps in protection, the austerity, a lack of solidarity, very individualized solution that leave the most vulnerable excluded from really the adequate coverage and no decent work. So I think this is really where we, I mean, we already see that even though we're in the middle of the crisis, we already see what's going to come. And I think now with all the positive turn when it comes to the emergency social protection measures, but I think the question is, are they going to be transformed into more sustainable systems that are there to stay? Or are they going to cut back very quickly after the immediate effect of the crisis and leaving people as poorly protected as before, or even worse? So with that few words, I think I would like to hand over to our panelists. And I would like to invite Gabrielle to talk about the guidance for pension provision in times of COVID-19. And I think this is an extremely important piece of work, and I think it has already been quite influential in many countries, really seeing on how pensions can actually be delivered in a safe way in times of this pandemic. So please, Gabrielle, go on.
Thank you, Christina. So as Christina mentioned, I'm going to be reflecting on the set of guidelines that we produced around administering pension payouts to reduce infection, and guidance on how to share information with older persons on how to reduce their individual risk when they collect payments. So I'm going to give a very broad overview of them. They are online, they are very detailed. So I'm just going to give a brief synopsis and then talk about some of the minor changes that we are going to make to them. And then my main focus is going to be on how they've been implemented and some of the most common administrative changes that have been made globally to pension payments to protect older persons. And then finally, I'm going to just look at a case study of implementation challenges that might help us to reflect a bit on aspects of the guidelines that could be more difficult to implement, because it's one thing to sit in your office and create a set of guidelines, and another thing to see what's actually realistic to implement on the ground. So the guidelines are available at the link at the top, and also the link near the bottom on information sharing is a separate set of guidelines that you can refer to. Just in summary, our main focus is on reducing infection at pay points, and trying to get by either having people avoid pay points if possible, or by using other modalities, or reducing the risk of infection at pay points by using things like screening protocol, hygiene protocol, etc. So in terms of the payment arrangements, there we focused on trying to encouraging payments to happen in different ways, and there we one thing that we want to add is to emphasize that it's important to spread payments across multiple modalities to avoid overburdening any one system. So not having everybody suddenly rushing to the ATMs and creating long queues there, where it could be spread better. Nominating proxies is something else that we cover. Exploring electronic pension payments, providing some discussion on how that could happen. And as we revise that, we really invite your input on what might have happened in terms of implementation across the world. It would be interesting to reflect on that. Then in screening protocol, that's one thing that, as I'll discuss, I don't have much insight into how extensively that's been implemented. It's probably more tricky and resource intensive than a lot of the other guidelines that we've recommended. And so it'd be interesting to hear from any of you what your experiences have been there. The one insight that I think that we've had and that should be added to the guidelines is the necessity of combining screening at pension payouts with community screening initiatives. So they're not happening in separate silos, and that resources used to do that are pooled, and it can be information shared effectively there. And then in terms of hygiene protocol, previously we hadn't included the wearing of masks because it wasn't included in the WHO protocol at the time. It seems to be something that's been quite widely implemented across the world, and it's been mandatory in some countries now to wear material masks. So encouraging older people to wear those when they go and collect their pensions. The other thing that it covers is safety and security in terms of older people, managing people at pension payout points and directly outside of payout points. So you can go have a look online there, and I'm not going to get into any detail. We can discuss further in the questions though, if you want. Can you go into the next slide, please? So what I really want to focus on is in terms of what's been happening in terms in terms of changes to pension payouts to protect older people. So we've understood that the guidelines that we created have been shared widely, and they've informed national guidelines in Kenya and Philippines. Those are two examples that we know it's definitely informed their policy. Elsewhere, we can't be quite so sure, but just from some general research and reading that we've done, it seems that there have been quite a lot of measures undertaken across the world to reduce the risk to older people. So I want to discuss those briefly. The most widely implemented has been social distancing in queues. And I'll show you some photographs of different approaches that have been taken, but that has been probably the most common approach. Other measures that have been taken include the appointment of proxies, so having someone else who's lower risk collecting the pension payment on the behalf of an older person. That's happened in Algeria. Bahamas has offered advances of payments, so allowing older people to have more income available to be able to effectively kind of stockpile some of the key things they need to survive during lockdown, or to avoid having to go out of the house as frequently. One thing that's been implemented quite widely, which wasn't actually part of our recommendations initially, but seems to have been taken up, is the home delivery of pension payments. So having community health workers, or in the case of Belarus, they've used their postal workers to deliver pensions to older people, so they don't have to queue or leave their homes. And that's also happened in the Philippines, Armenia, and Turkey. Bi-monthly payments have also been implemented. So, instead of having where monthly payments generally happen, reducing the number of times that people have to go and queue for payments. The staggering of payment days has been implemented in South Africa. So separating out older persons and people with disabilities from the rest of the population that collects other types of social grants. That has been ineffective in South Africa, and I'll talk to you a bit about that shortly. But the principle of it is probably good. I haven't seen as much a movement towards electronic payments for social pensions as we have in terms of new cash transfers that have been introduced in terms of COVID. I don't know if anyone has any input there, but the only example that I found was in South Africa, the introduction of cashless ATMs, where they reduce the need for cash. That also creates more opportunities for people to draw money from their social grants, and then they get a slip which they then give to a vendor, and so that that's a new thing that's being rolled out in South Africa. The reduction in administrative burden has happened in Trinidad and Tobago in terms of reducing the need to provide proof of life. The removal of ATM fees was one of the things that we recommended, and that seems to have happened in several countries. Latin America and Ecuador, Colombia, and Peru, and then also in South Africa. So encouraging people to use ATMs instead. And then hygiene procedures seem to have been very widely implemented. And then the screening, as I mentioned, it's not clear to what extent this is happening, and I'd invite any input there. Would you mind moving to the next slide, Lucas? So these are just some examples of appropriate social distancing for the collection of old age pensions. So the top one is in Peru. You can see they've also got hand washing facilities available. It means you don't have to kind of have even access to running water to be able to provide access to those facilities. And the one below is in South Africa at retail outlets, where a lot of the payments are made using shopping trolleys to separate people. Could you go to the next slide, please? This is in Pakistan and India, using placards and kind of chalk spacing between people, and also, all of these examples have included, opportunities for people to sit, especially important for older people who might not be able to stand in lines for long periods of time. Could you go on, please? Next slide. And then that's just one more example, I think, from Pakistan. Okay, next slide. Thanks. So then I just wanted to talk a little bit about the South African case, just in terms of how tricky it might be to implement kind of large scale changes across the country in a really short period of time. And some of, maybe there can be some learnings from some of the mistakes that South Africa has made. So the first initiative that was taken was to separate out older people from other grant beneficiaries, because we have a very large child support grant with millions and millions of people who are generally accessing their grants on the first of the month. So they decided for April payments to pay early, and so just for older people and people with disabilities, so on the 30th of March, but they didn't actually separate out the payment files so that the money went into everybody's account, and it was very hard to keep child support grant beneficiaries away from pay points, especially seeing it was being paid early and people were desperate. You had older people being shoved out of the way, older people having to wait in the same lines as everybody else, and it was completely ineffective. So what they've done now is attempted to separate out the payment files so that the money only actually lands in people's accounts for withdrawal from whichever point that they want to draw. The challenge with that has been the closing of the South African Social Security Agency offices over what we call the level 5 lockdown was completely shut down, and then now it's been opened under level 4 at a just minimal operations. And so what happened at the last payment date was the files weren't separated properly, and you had older people, some older people got dual payments, other people got no money, and it's created hugely long queues and a lot of confusion. So also what happened was they decided that it was important to keep the cash, the social grant beneficiaries away from the kind of the end of the month shopping, because a lot of people do draw their money at retail outlets. But what they did was they delayed it by 4 or 5 days into the end of the month, which meant that people were waiting almost a week extra and hadn't necessarily budgeted for that, and put a lot of financial pressure on people, which seemed quite unfair and created a lot of confusion again. Also, because most of the payments are made either at retail outlets or the South African Postal Office, some people also do draw by ATMs. But in rural areas where those facilities aren't necessarily available, SASSA was still providing pay points and giving out money directly. But with the closure of SASSA and they closed all of the rural pay points, presumably to protect their workers. What happened was then that all older people, who many of which live in rural areas, were forced into towns and cities to go and draw their money. So having to use public transport, then having to queue in extremely long lines. There were incidents of like 2-kilometer long lines where social distancing wasn't observed, people dying in line, sleeping overnight, and creating a lot of confusion, and then this was made worse by the fact that a lot of people weren't able to get their money after standing in a 2-kilometer queue. So and then social distancing, although the wearing of masks is now compulsory in South Africa, when you're out in public, it wasn't observed. Older people have complained that they can't afford to buy material masks, and so then are kind of breaking the law when they're going to collect their money. And the media has been flooded with examples of how social distancing hasn't been properly observed, and there's been a lot of criticism of just how the whole payment of social grants in general has been administered in South Africa. So, the challenge demonstrated here is that, you're trying to deal with, there are 3 million pensioners in South Africa that are receiving the old age grant. You're trying to, plus the almost 2 million people with disabilities who receive disability grants, trying to deal with large numbers of people without, having properly thought protocol and thinking about the consequences of changes that you make has resulted in a lot of chaos and a lot of fear that that pension payouts are going to become like a source of infection in the South African context. Can you go to the next slide, please? So this is just an example of a pay point in the most recent payouts over 4th and 5th of May. You can see that people are wearing masks in this example, and there is to some extent someone monitoring social distancing, but it just attests to the very large numbers of people that were coming out for payments. And can we go to the last slide, Lucas? Thanks. And this was a snaking queue that went on and on and on. You can see that there's no measures in place. People are standing around for hours and hours, and it was just kind of deemed quite ineffective. So yeah, that's just the example of the South African case. There has been no screening or kind of relationship between the community screening programs that have supposedly been rolled out in South Africa and the payment of social grants. And you know, there's definitely an opportunity to tie those two together. So that's all that I had. If you want to hand over to Florian.
Yeah, thank you so much, Gabrielle. So this was excellent, and thank you also for keeping the time. It was extremely illustrative. I mean, on the one hand, really, I mean, all the measures that have been taken, but on the other hand, really pointing to the very practical difficulties that exist. So that was maybe just one quick question that came through the chat, just for clarification. There was a question, if you could clarify what you meant by screening in the context.
Oh, sure. So yeah, we have quite a large section on that in our guidelines. So screening is basically trying to ensure that people who are infected are not entering into the payment, the pay point. So the screening could take the form of temperature checks, or it could take the form of a general questionnaire that asks about symptoms. I mean, obviously, that kind of screening doesn't protect you against asymptomatic people entering into the payment facility. But the idea would be that if you had screening at the entrance, you could, if people were symptomatic or had high temperature, they could be moved into a separate area where they could then appoint somebody to come and collect their grant or their cash transfer on their behalf, and then they could be referred onwards into the health system. Obviously, the challenge with that is that temperature measurement is not always available, like especially in more rural areas, and it obviously creates blockages in terms of the flow of people. It takes time. It's one thing to recommend, and I'd be interested if anybody has any insights on efforts where that has been made, whether it's been effective at all.
Okay, now thank you very much for that quick clarification. And I should also mention, and I'm sorry, I have forgotten to mention that at the beginning, we are collecting lots of your questions that we're going to answer in the question and answer session after the presentation. So please use the question and answer box for your questions. And if you want to have any other comments, please use the chat if you would like to. And with that, I'm handing over to Florian. Please go ahead.
Thank you. No, it's really evocative and really insightful to see those pictures, I think, of how things are, you know, to some extent going wrong in the collection of these grants. And in a way, I think my presentation, I'll talk about income security, social protection for older people, kind of, I see it as kind of the backstory to some of those pictures. You know, they try to explain to some extent what the stakes are and why, you know, people are lining up for 2 hours, and, you know, what is the importance of pensions for older people. And obviously, while those scenes are disturbing from South Africa. To some extent, they're the relatively lucky ones that lives in place where there is a decent social grant systems in place, whereas many countries that isn't the case. So yeah, I'll talk a little bit about income security, social protection for older people. We now, obviously this started as a health crisis, and that's kind of maybe the immediate first priority, but as this kind of has the ripple effects and is turning into also an economic crisis and a social crisis, HelpAge, as many organizations, is starting to think through what this means. What are the repercussions from an economic perspective, from a social perspective, for older people. And so what I'm presenting is kind of my current thinking, some initial maybe evidence, but it's clearly evolving. And recently, one of our communications person, as we were developing a brief about older people income security, was kind of asking me, being a bit of a devil's advocate, to say, okay, Florian, but why? What's so special about older people? Why should we care beyond the fact that obviously nobody, all people have the right to social protection and nobody should live in destitution. That's clearly a human right and should be enough for all of us to care. But like, is there anything unique to older people that makes the stakes even higher? And I was kind of like thinking about that. So I hope my presentation kind of answers a little bit this question, why should we care? Can I go to sorry, I was clicking on my keyboard. Can I go to the next slide, please? Thank you very much. This is just a little bit of background. I'm not going to get too much into this, but I think it's a helpful piece of kind of background information. Essentially, in many low-income countries, we know that older people remain economically active, right? I mean, the retirement that, you're 60, 65 and you stop being economically active is not a reality in most countries. And even if we say, and even then in places where people are no longer technically working, obviously we want to maybe investigate a little bit further what, economic activity or productivity means. Obviously there's a lot of unpaid care and there's other parts of being productive, but in terms of a more narrowly defined economic work, that remains an important element of older people's lives in low and middle income country. Nonetheless, the likelihood and intensity of paid work does decrease significantly with age. But if you look at, for instance, labor force participation rates in low middle income countries of older people, they're significantly higher, and they're significantly higher for men. And again, we're talking about paid work here. Obviously, older women do a lot of unpaid work. To some extent, it's it's an economic necessity. There's this relationship with poverty and lack of income. It's mainly the informal sector, and while older people rely to a large extent to families support them, that support is often unreliable and infrequent. None of this we need to go into too much detail, but I want you to take away that older people's income in low and middle income countries often is a roughly equal mix of work, livelihoods, family support, and social protection, pensions that often are relatively low or have low coverage. So this mix of income, I think, is important for the story that I'll try to tell now. And you see some examples here from Vietnam and Thailand, where it's obviously depends on the country, but these are all crucial components. Can we go to the next slide, please? So obviously, and I'm not going to. You might have seen this graph before, or similar evidence that it's now emerging from various countries about the just collapsing incomes. This is here from daily diaries of low-income households in Bangladesh. I think it's a UNICEF report. They keep track of daily income, or it might be expenditure. I'm not 100% sure. But in March up until the lockdown, and then what happens once the lockdown's in place, and it's a total collapse. Obviously, we don't know to what extent this is permanent, and obviously these might be low-income households that might be differently affected. But I think the overall picture, and Christina talked about this, I think, in the introduction, the evidence that incomes across the board in all countries are hit very hard. Obviously, some people are affected more than others, but I think it's a real reality in low-income countries. Can I go to the next slide, please? The next slide, please. Thank you. So this was general households, right? What I think is unique about older people, and why I think this is a story worth discussing, is that in some ways, not all, but many older people are hit from multiple fronts at the moment. Again, this is all, we're actually setting up a few really interesting research initiatives to look at kind of the poverty and income of older people in this COVID crisis. But as of now, there isn't yet so much evidence. But we do hear from our network members around the world. We hear these stories, how there's an example here from Sierra Leone, where a older woman was supported by her eldest daughter, who worked as a domestic worker, as a nanny, but essentially she lost her employment because of COVID, and was told not to come to work until the pandemic is over. And now she's no longer able to support her mother. So the crucial family support that older people have relied on to a good extent is in many places is no longer there. Children are just no longer, or many children are no longer able to provide that. And we already know from existing evaluations that, for instance, we did an evaluation of the social pension in Zanzibar, and if we talk to the family members of older people, they say, look, I don't have a job, like I'm struggling to even feed my immediate family, and I help when I can, but I just don't have the general level of poverty is such that I've struggled to support my mother. There's another story here from Gaza Strip, an older woman, 75, who has diabetes and high blood pressure. And she usually gets by buying the medicine that she needs by doing kind of petty trade, buying secondhand clothing, and reselling them. But because of the lockdown, she's no longer able to do that, and essentially is unable to afford her medication. So I think the crisis really affects, obviously, households as such that then are no longer able to provide support to older people, and whatever livelihoods older people have themselves, they'll often find it much harder to work. And I think what's unique about, and that's why I think social protection is it's always been crucially important, and there was never an excuse not to provide income security to older people. But I think the urgency and importance has grown so much because of the health vulnerability that older people have, the higher likelihood of having severe health issues or even mortality because of COVID. It's going to make it very difficult to engage in income generating work over the next couple months, maybe year. So the trade-off that older people face of going to the market and trying to make a living and thereby really exposing themselves to a potentially dangerous and life-threatening situation, or staying at home and not maybe receiving or not having food to eat is an unacceptable trade-off. But I think that's the situation that many are facing. Obviously, many families as such are facing this challenge. The additional challenge, or what makes it even more severe, I think, for older people is the higher likelihood of death that would come with. Can I go to the next slide, please? Thank you. So just, I won't spend too much time on this, but there's been some initial estimations on what would be the kind of global impact on poverty. This here is from IFPRI, the Food Policy Research Institute. They estimate between 80 and 130 million people in 2020 in extreme poverty. So this is like absolute destitution. It's $1.90. The World Bank, I think, is a little bit more optimistic. And I think, well, optimistic is maybe the wrong word, but expecting, I think, 60 million people in extreme poverty. And again, this is extreme poverty. If we can go to the next slide. So just, we've done a little bit of a kind of an estimation what that might mean in terms of numbers for older people, and taking the World Bank's estimation of the economic kind of contraction in sub-Saharan Africa, and assuming that older people are not worse hit than the general population, which is, I think, an assumption that is a simplification, and I actually believe they might be, hit harder than the general population. But just assuming the distribution kind of stays the same, we would see a significant increase in sub-Saharan Africa between 1.5 and 2.3 million older people. Again, this is just destitution. This doesn't account for the people who are maybe not, below $1.90 a day, but are still, losing significant, incomes and and just that their living standards collapsing. And in this conversation with our comms team, as we were kind of discussing why older people, why this is relevant for older people, one of the thoughts was that older people might have less time also to kind of recover from this. I think if a young person, for instance, I think we're in the UK, I think kind of young people in the informal economy tend to be the most hardest hit. I think that's what the kind of research is showing. And that's horrible, and we need to do something about it. But maybe there is an argument that, okay, this is the beginning of life. There's a lot of time to recover and be productive. That might not be the case for older people, without wanting to get into that too much. But I think the projected increase in really destitution is quite scary in sub-Saharan Africa. And if we can go to the next slide, please. Because that's the good news now, I think. Yes, so this is essentially a lot of stuff that I've stolen from the ILO. So thank you for your great dashboard. It's
No, you have not stolen it.
I'm giving you actually credit. It's cropped out. I can't see it, but it's there. So check out ILO dashboard. It's weekly updated. It's a great source. The good news is that a lot of countries are introducing new or expanded social protection schemes. It's a little bit of building a plane. What's the saying? Building a plane while flying. And countries obviously that have more robust systems in place, I think, are able to respond much better. So we see a lot of countries introducing new benefits for either what vulnerable populations. So that might be the kind of general social assistance, workers' independence. There's some, and Gabby talked about it already a little bit, some kind of relaxation of administrative burden. So in many countries, for instance, where there might be a disability pension that would have to be kind of, I guess disability status would have to be proven every couple of months. That's been kind of put on hold. So these kind of, in I think some countries, you need to give a life certification to receive your pension, and that's been kind of like put on hold to reduce the risk. So there is this flurry of activity, which is fantastic, and I think it's one of the takeaways here is, for instance, if you look at pensions, it's only 6% of all global measures. So there isn't, I think, coming from this overwhelming, let's say, health risk and evidence how older people are affected on that level, that doesn't quite translate itself into a social protection response that focuses on older people. This is not to say that other groups shouldn't, I think there's obviously the informal economy and workers. I think maybe there's a more of a need for catch up. So maybe that explains some of the big initiatives there. But I think it's fair to say that pensions aren't, well, I'll get to that question. Pensions aren't a massive focus. Can I go to the next slide, please? Can I have the next slide, please? Thank you very much. So then I've looked at the various mapping initiatives by obviously the ILO, World Bank, UNICEF, and others, and try to take a sense of, okay, well, what's happening for older people? The first couple of bullet points just restate, I think, why this is relevant. The risk of older people going into markets over the next couple of months might be unacceptable. Families might be struggling to support them. So, now is really the time to make sure that that risk isn't something that older people should be facing, that trade-off. And obviously, general social assistance is important, but it will leave, many older people out. I've been speaking to colleagues in Thailand where they have a new kind of a grant for the informal economy, it's essentially, it's like an online kind of registration scheme for informal economy workers. But from what I've heard about our network members there, that's very difficult for many older people, and they feel they are not. Many are struggling to include to be included. So I think what we should think about is to what extent we can, strengthen social protection mechanisms that are designed for older people, and rather than hope that they'll be included in kind of these generic social assistance schemes. I'm almost done. Can I have the next slide, please? last time I was supposed to speak for 10 minutes and spoke for half an hour, so I'm doing already better. This is just a summary that I try to do income generating activities, essentially a broad term for any kind of work that might be employment or small businesses. So here I looked at what are countries doing for older people. There's a good number of countries that are increasing pensions. The pink ones are kind of permanent, or at least it seems permanent, and the red ones, the 19, are essentially top-ups. Then there's some in-kind support or cash transfer to older people, 14 and 7 countries that mention older people as a group of various vulnerable categories, which is good, but I think it remains to be seen whether that reaches older people. I'm thinking, for instance, the Philippines, where they've introduced 5 different cash transfers, but are really struggling to get those to people and to do the payment. There's a good focus on kind of like safe pension delivery, advance of pension savings. Something that I've only recently picked up is this kind of allowing people to access their pension savings. You know, just kind of with you know, kind of funded pensions, usually in the private sector, where people are allowed to essentially take their own savings and withdraw them now without penalties, which is cool, but I'm sure it's going to come, you know, that's going to be painful when retirement comes. So anyway, that's so my point here is, I know I'm running out of time, and maybe we can discuss in Q&A a little bit more. I think it's good news that a lot of social protection activity is taking place. And here are some examples of what governments can do to protect older people in this crisis. And can I go to the next slide? There's some country examples.
Very, very quickly, because you're
very quickly. I'm not going to spend any time, but there's some countries, for instance, that are now adding making social pensions universal. So it's in Bangladesh, they have a targeted old age pension in about 2/3 of their, so maybe like, I don't know, yeah, 30% of the country, that's now universal. In Sri Lanka, they add people of the social pensions waiting list on their social pension. So there are these initiatives that can be taken, and some countries are taking them, but it's obviously not nearly enough, and not nearly as many countries. So there is a real need, because this is not going to go away, I think. And if we don't put systems in place to provide income security for older people, it is not cool. True, Simone. Thank you very much.
Thank you very much, Florian, for this kind of extremely informative presentation. It was great. And I mean, I saw that you were struggling with time, and we would have loved to have more time. But maybe we can pick that up also in the question and answers. And in that, I would really like to encourage also everyone who's listening and thinking about the very important questions that you raised, to raise any questions in the question and answer. But I see that some of them have also come through the comments, so this is fine. So last but not least, I'd like to invite Lucas to with another country example, this time from Peru. And Lucas is going to talk specifically about both pensions and health in the context of COVID-19 in Peru. So please, Lucas, go ahead.
Thank you very much, Christina. Hopefully I will meet the 15 minutes. This is kind of the outline of what I'm going to talk. Basically, it's a research. We are engaged with colleagues in the UK, in Peru, and we are in the initial stages of the project, but there still give us some interesting insights we would like to share and discuss also. So the research context is quite interesting. There is a evaluation scheme linked to a private organization, CS, and funded by the Ministry of Finance, tied to what they call spending effectiveness. In this case, the team includes a doctor from one of the most important university medicine schools, and also from social sciences. The proposal and the award of the research grant was made previous to pre-COVID, which also presents some challenges that we are dealing now with them and trying to learn how to address research and data collection on these times. So a very simple, quick overview. We are talking about non-contributive pensions. It's called Pension 65. It has begun in 2010 as a pilot program, Gratitude. And from July 2011, there's new government. The new program has a new name, expands significantly the coverage, lowers the age limit to 65 years, increases the value of the subsidy. It's about $70 bi-monthly. Just as a reference, the minimum wage monthly is $275 in Peru. And at the beginning, it was focalized on poor districts and deprived households. Peru has a quite interesting and robust, it's not perfect, but it's robust when compared to others, household social economic system. So they were able to target poor districts and within poor districts, deprived households. One interesting thing of the program design is that it includes synergies with health services and considers health outcomes as desired and impacts, which give us the opportunity to study the connection between the pensions and the health services and outcomes. This is data from this week or this month. Right now, the coverage is the whole country, almost 560,000 beneficiaries and around 120 million dollars until April of this year. The data, it's perfect, which is kind of weird. They say they attended 500, the exact number of beneficiaries from January to February and March and April. But besides of that, it reached a very nice and extended coverage during 8 or 9 years of program. And this is data from 2019. The health campaigns, they have been organizing around 7,000 health campaigns during the year in medical centers, primary care health centers, and about 300,000 beneficiaries having received some sort of health advice or attention. There is prior research and prior data on this link between pensions and health. There was a quasi-experimental impact evaluation that shows some improvements in mental health. Depression scale of pensioners was lower than from those that didn't receive pension. And the feelings of self-worth were higher of the beneficiaries of Pension 65, but they didn't find significant improvements in terms of measure health, hypertension, waist circumference, memory scores. Other set of data that is collected by the Ministry of Social Development, by the Directorate of Monitoring and Evaluation. They don't see significant changes on the use of health services over time. That this is data collected for like 6 or 7 years, and it hasn't shown much change. So based on that, what we are trying to understand is why people don't use more the health services, and what is done to improve the articulation between pensions and health. This is the evaluation framework. Basically, at the left, you can see the pension being given to the beneficiaries, and at least three different paths: the use of health services, how pension could trigger other behaviors, and how also pensions could cause some protective effects or exposure to other risks, anxiety of not receiving it, not working in dangerous work anymore because you receive the pension, the risk of pension collection during COVID, lower social status because you receive pension and others in your community don't. So there are at least three paths we identify as relevant ones that they are linked to health outcomes. And what we are going to look at during, or what we have been looking at during this research, basically are the articulation between the pension and the health services. And the articulation means what happens at national level, at policy level, and what happens at local and regional level. In Peru, the local level does not have health responsibilities, but it has social assistance responsibilities, roles, and the regional level has health, the health administrative role. So there is an interesting connection between the three levels of government and the pension that is centrally managed. And one of the big assumptions in here is it's not just about articulation, but it's also about the quality and efficacy of the health system. So those are the two big topics we are looking at, and we're trying to produce qualitative insight, in-depth information that help us to redesign and to improve the program articulation. We are in the initial stages of the project. Data collection and fieldwork plans had to change, obviously, because of the pandemic, lockdowns, flight bans, and all. The policy review we have been doing gives us interesting information. For example, the links between pensions and health services and outcomes is not entirely clear in the design. It has changed over time in documents. The pension 65 is a result-based finance program, which also has not have clear outcomes in terms of health. National level, there is not much coordination between pension and health ministries and agencies. And at local level, there are more opportunities for coordination. Basically, because we are looking at rural areas where population, remote areas, not very big numbers, so local level have a relevant role there. And the final conclusion on the policy review is there is no clear theory of change. Somehow there is this idea of automatic health benefits by receiving pensions, and in other different paths there is this idea of design-in effects, doing health campaigns, articulating, so doing things beyond just these automatic health benefits. I'm not going to talk about the responses because they were very well covered by Gabriel and Florian. And I have just two more ideas. And there are reflection based on what Florian and Gabriel and on my own piece. And the idea of this project is to find opportunities to improve, and they are linked to a very special timing, which are in the pandemic. And we are able to see a lot of interesting positive changes in policies, advanced payments, temperature checks, increase of benefits. So this time it has become an unintended great opportunity to pursue innovations and improvements, when in normal times the bureaucracies or the length of change, it's a lot larger, a lot longer, a lot more difficult. So the opportunity to find interesting improvements in programs, in this case linking health and pension, it's a good timing for that. And the second idea I have is, there are two very different types of improvements and links we can do in pensions and health. We can do one that those that don't have costs. So we use what is in the infrastructure, in the social, in the policy infrastructure, and we try to make improvements based on what's on the field. And there are the other ones that have costs, and with austerity measures, they're going to be a lot more difficult to put on place. But if we look at them as two different set of opportunities, we could evolve and we could make programs like this to have a greater and a better impact on health, on people's health. That's it, Christina. I managed to finish before the 15 minutes bell.
Yes, yeah, no, thank you very much. That's much appreciated. So we have 2 minutes more for the discussion. And this is great. And thanks a lot for sharing your insights from Peru. I think you made a lot of important points when it comes to the important linkages between pensions and health. And I think, I mean, also the point that you made about the improvements that have been made in times of crisis, but also the questions, are these going to stay, or are somehow the systems kind of falling back into where they were before, or possibly even worse. So now we have 22 minutes left for the discussion, which is great. And we have, I mean, Steve, we have a very active exchange on the chat. But I would like to start actually with the questions that came in through the questions and answers. And then if we have a bit more time, then we can.
Hi, Christina. I think we've lost her.
Hi. Well, it sounds like we've lost Christina. This is Peter here. I'm not going to put on my camera because I wasn't expecting to put on my camera, and I don't have a very professional background at the moment. But yes, I think while we're waiting for Christina to come back online, I will simply read out some of the questions. Some of them are directed to specific speakers. One of the questions is, are there any countries which have provided more generous pensions as an economic stimulus? I think in a way, Florian, you already covered that in your last slide, but since you were cut off in your prime a little bit and you weren't able to say very much about that, it would be interesting. In fact, another question relates to that as well, in terms of governments providing more tax-funded benefits for older people in the context of fiscal squeeze. So do you think that this is something which is going to be sustained? Do you think that this is something which is is a flash in the pan? What are your views, particularly Florian, but also I'd be interested to hear about Peru and South Africa.
Thanks. If I understand the first question correctly from Aura is whether countries have expanded pensions as an economic stimulus. I don't know what the motivation has been for some of those countries that have expanded pensions, and we do know that they are social protection in general, but also pensions, because pensions are often a very large element of social protection that reaches many people with often quite substantive transfers, maybe as compared to some other forms of social assistance, are automatic stabilizers in an economic sense, that they protect demand and keep the economy going. We also know about economic multipliers, how the money that an older person receives gets passed on in the local community and creates kind of economic growth there. So that argument, I think, is there. I wonder whether countries are at the moment thinking about that, like the idea to kind of stimulate the economy. I think that we were going to see a very interesting conversation around that maybe in the next couple of months, as more countries will focus on kind of the recovery and the building back. I think at the moment, I don't think this has been a big motivation at the moment. I think at the moment it's about protecting people and making sure that they can buy the necessities that they need. So I think we'll see a transition to that kind of like economic argument maybe in the next couple of weeks and months. What's interesting is usually with the normal crises, a normal economic crisis, social protection is a multiplier in that sense and has these economic boosts because we want people to go out and spend the money. The moment we don't really want them to, go to bars and cafes and restaurants and spend their money. So I think it's a slightly different justification for now. The other question was, what do you say to governments who are wary about the political consequences of providing social protection to older people, because there might be expectations that they will continue to receive those benefits? It's a good question, and maybe the relative lack of action with a kind of group-specific response to older people, essentially an expansion of a social pension, is government's fear that that they will be difficult to scale back. And I have to be honest, I'm certainly hoping that some of these expansions, particularly of social pensions, are sticking, because politically it'd be very difficult to take away pensions from people. And it might be much easier to scale up and down kind of general social assistance, cash transfer, where it's a little bit less clear who they're for, and they're more narrowly tied to the economic fallout of COVID, rather than a particular group such as older people that I think will continue to need this kind of social protection even after the crisis. So it's a good question that that government might be cautious about it. It's certainly no excuse. In terms of fiscal space, what's I think so fascinating about this crisis is that all these things we were told we could never afford, we all of a sudden can. It is a question about I guess where to what extent that's being borrowed, and there will be kind of a hangover to this, but fiscal space doesn't seem to all of a sudden doesn't seem to be a major concern. It's much about like protecting your populations.
Thanks. Any quick additional thoughts specifically about Peru or South Africa? From Lucas and Gabrielle, that is.
Lucas, do you have anything?
Sorry.
Hi, guys. Any particular comments? You don't have to answer. We've got a number of other questions if you'd rather skip to some of our other questions.
I don't have any.
Yeah, I don't have anything.
Okay, we're still waiting for Christina's microphone to come on. Oh, no, it's on now. It's on now. Okay,
yes,
I'll hand over chairing again.
Yeah, thanks a lot, Peter, for stepping in. Sorry, I had muted myself and forgot to unmute me. And in addition, I had a nice message from my computer colleagues that my computer is going to restart in a couple of minutes automatically, and I couldn't do anything about it. But that is solved, so that's great. So No, thanks a lot, Peter, for stepping in. So maybe if we go to another set of questions, and please bear with me in case I'm asking the same questions again by mistake. There is an interesting question coming in from Jane Simmons, and she's asking about the role of older people as primary caregivers in many instances, and the fact that pensions are often the sole source of income in a household. And I think it's interesting to see, and maybe specifically now for the cases of Peru and South Africa, whether there have been any kind of adjustments or any acknowledgements of that in the way how the governments reacted to the crisis and adapted the pension schemes and also the delivery mechanisms to that fact. Would you have any insights on that specific question?
So in case of Peru, Gabriel?
You go first.
Okay, thank you. So in case of Peru, what they done is this, they put together two benefits in one, and as it is bi-monthly, naturally now is each 4 months, which brings more cash to the household, but also has the possible negative effect that they spend money, the whole money in the first 1, 2, or 3 months, and they will be run out of money by the end. And there has been a couple of universal benefits they're giving to one-time benefit, but it's not entirely clear if it overlaps with this pension or if the pensioners are out of this universal scheme.
Yeah, thank you very much, Lucas. Gabrielle, would you like to add anything to that?
Yeah, in terms of the South African context, so much research in South Africa has shown the important role that grandmothers in particular play in terms of sharing their pensions within households, the effects that it has on children, and obviously the important role they play as caregivers as well. So there is a lot of concern about death of older people and the impact that would have on communities, because pensions are often the only source of income of many households. In terms of the government's response, they've increased all social grants. The old age pension has increased by 250 Rand, which is not a huge amount of money. Instead, they've really focused the intervention on caregivers of children, primary caregivers, so not on grandparents. They firstly gave money to individual children that were receiving the child support grant, and then and now for the first month, and then from then onwards, it's a per caregiver, regardless of the number of children. So it's much less money actually, and there's a lot of criticism around whether you're actually giving much more to children overall. So in short, the response hasn't been focused on the pensions really, despite the important role that older people do play in caring for children, the sick, etc. Sorry, excuse my baby.
No, we're very happy that you have your assistant with you. That's
times of COVID and time. I'm sorry.
Yes, no, but that's very nice. Thank you. Florian, would you like to add anything to that?
Yeah, just there's a question here on that in South Africa the child grant has been, and I think the disability grant has been increased, and the question here is whether the old age grant has also been, the old age pension has also been increased, and I think it has, hasn't it?
Yeah, by 250 Rand. So there's no special. That's the same. They've increased all grants, and but there's been no special provision for older people. Basically, they've just increased all grants overall, but the main focus in terms of increase though has been on child support grant.
But I think that I just wanted to reference that as that was a question to it. But I think obviously the role of pensions in crisis is something that I think is very, very interesting, and it's something we I haven't really thought through, and I'll be curious to see maybe whether there's any studies on that. But I think in many crises, and even if you think about maybe the kind of the European economic crisis, in many kind of countries, like older people's incomes and pensions were one of the kind of stable sources of incomes that households, particularly in some of southern European countries, could rely on. So I find that a kind of an interesting component of the shock response of social protection discussion that I'd like to explore more. Because that's often a source of income to households, and it is often shared. We find it sometimes very difficult when we try to evaluate social pensions to kind of disentangle various sources of household income that older people often see as this is just one element of the types of incomes that a household receives and shares within the household. So yeah, it's certainly, I think it's hugely important.
Yes, absolutely. And I think the examples that you mentioned from Southern Europe is also very, very important. I mean, this is really what we have seen in many countries, including Portugal and Greece and other countries. So no, indeed. I saw that there have been a lot of questions coming in regarding where to find the questions and answers. I mean, I see them on the bottom row on my screen. There's an icon say Q&A. It's next to the participants. I hope you see that as well. But if you don't worry. I mean, we're going to pick them up and read them on. So I think there was one question which I've now lost. Or maybe no, sorry. I just see another one, which is a good follow-up question to the discussion that we just had. So let's maybe tag that one before. This comes from someone who's not indicated his or her name, asking that in Peru and South Africa, people aged 65 plus and above are less than 7% of the population. How do we justify providing benefits to the elderly over other segments of the population? I think you have already partly answered that question in the previous discussion, but is there anything else you would like to add to that?
Me or Gabby?
Well, anyone who would like to come in on that.
Yeah, I mean, I think, well, in South Africa, it's around 9% of the population are over 60, and I think that it definitely, I don't know, it is obviously justified by how pensions are also shared within households, because older people have well, especially older women tend to share their pensions within households more than other groups do. So I mean, I do think that also older people are more likely to be adversely affected and to be more vulnerable than other groups, that it does make sense to increase the benefit for them. But in the South African case, it hasn't really been a special focused initiative anyway. It's as you said, the focus has mainly been on children, and that's also largely because they've closed schools and school feeding programs, and so that money is seen as a substitute for that.
Yes, yeah. Thanks very much.
May I also respond?
Yes, yeah, please.
Sorry. First of all, smart move not to share your name, whoever asked this question. No, I mean, I think there's one way to answer this is by saying that, everybody has a right to income security. Doesn't matter what proportion of population you represent, that is, you know, it's not, we're not saying, oh, people with disabilities is only this section of the population, so we wouldn't focus on that. So I think that's whether it's 7%, 10%, it shouldn't matter, I think, at some level. On another level, obviously, nobody is saying here that only older people should have social protection. I think most countries, if not all, have the capacity to do something for, you know, older people, children, and other groups. There isn't really, I think, a need to weigh one against the other. Maybe in the immediate short term, but even then, I don't think it's not really the case. Then the final point is, and I promise I'll stop after that, is that, you know, it might only be 7% of the population, but I'm sure, you know, we all would like to have a pension when we're older. So it is universal in that sense, that I think nobody would be willing to give that up. So a final point, sorry, there's so many, is obviously that population is only going to grow. So if we don't set up systems now, we're going to have a real crisis at our hands. But that's it.
Yes, yeah, no, thanks a lot. And I think maybe also another part of the response could also be, because I mean, a lot of governments are struggling to see, because I mean the needs are so big. And a lot of governments are struggling with the fact that the targeting mechanisms which have been used before, quite often, there were a lot of problems before with them, but now in the crisis context even more. So I think using old age pensions also as a mechanism to quickly channel resources into households, I think that's also a very important point in that context as well. So I mean, and I think more generally also using broader benefits going to larger groups of the population, categorical benefits rather than narrowly targeted ones. I think there's a big argument also to be made for that. So I'm afraid that we're running out of time, and I think we need to leave some minutes for Peter to continue and give us an outlook for the next webinar. So I would really like to thank everyone. Apologize to those whose questions we haven't yet answered, and I hope that there's a way that we can do that maybe after the session. And I would really like to thank especially the panelists for the very rich presentations and the discussion, everyone who has provided comments and questions. And I would also like to invite you to take a look at the presentations, which I understand are going to be shared. I think there's a lot of also additional information, additional references, links on that, which are really important for everyone who would like to know more what's happening. And so thank you very much. And with that, I'm handing back to Peter. Thank you.
Hi, Christina. Thank you so much for doing a great job of chairing and moderating and getting over various microphone-related issues. So thank you so much. Just two very quick points, because I know a lot of people have probably got to log off very fast. Firstly, we haven't advertised yet, but we're planning to have a webinar focused specifically on Latin America next Friday. It's not completely confirmed yet, but it's looking very likely. It's going to be, I'm afraid, in Spanish and Portuguese, because many of our networks in that part of the world don't speak English. But what I am planning to do is provide materials after the event in English, including probably me just doing a voiceover explaining what the key points made by the speakers and in the discussion. So watch this space in terms of that. Next slide, please. We're also wanting to take next slide, please, Lucas. We're also wanting to take a much more proactive approach to encourage people to send us their own webinar proposals. And the hyperlink at the bottom of this page takes you to an online form. And if you've got an idea, and if you can think of a couple of people who can speak to that idea, please complete the form and send it in. I just put down some possible subjects. They all must relate to older people in developing countries, of course. One of them might be elder abuse. A lot's been said about domestic abuse in the context of coronavirus, but very little about elder abuse. Today, we didn't talk about the potential financial abuse of older people. It's the most prevalent form of abuse in most studies of elder abuse. And of course, it involves less more coercive and less altruistic forms of household income sharing. And one can imagine that in many contexts, older men and older women may be under tremendous pressure to devote their pension money to other household members, and they may not always be happy about doing that. I think we need to try and understand more about the epidemiology of coronavirus, because it's been very, very surprising how the epidemic's played out, particularly in sub-Saharan Africa, with reference particularly to older people. It would seem now some people are arguing in countries like Uganda and South Africa that the response has been overkill. Has it or hasn't it? Very hard to say. I think we need to start to have more situated understandings of the different contexts, particularly overcrowded urban slum neighborhoods. There's some reference to the issues of managing the epidemic there, but very little specific reference to older people. I think sometimes the myth persists that these are relatively young populations living in slum neighborhoods in large developing country cities. They are not. They control large numbers of very vulnerable older people. Clearly, there are a whole range of gendered and intersectional issues that cross-cut, including race, with old age and coronavirus. And also, I think, trying to focus, as we've done a little bit today with guidance for pension payments, just thinking about very pragmatic and practical things that could be done to support nurses and care workers. Just some straightforward strategies and guidance. So those are the sorts of things. There's such a big agenda that we could cover as a group in our webinars. So I'm really hoping, because I must admit, after 6 webinars in 6 weeks, I'm starting to run out of steam. So it would be great if you could start sending in some suggestions via that online form. Also, we have loads of blogs on the website. They don't come out of thin air. They come from people like this who've been, no, that's okay, Lucas, you were right, sending in their wonderful contributions. If you think you might be able to say something between 400 and 1,000 words about older people and coronavirus in a particular part of the world, even if you think it's very anecdotal or informal. If you're not very good at writing in English, don't worry, we will proof it for you, we will edit it for you. It's very likely that people outside of your country will not know about what's going on. I've certainly learned a lot today about South Africa and Peru, and the whole ethos of this group is to quickly get information out there and to share it. So if there's anything you'd like to talk about, please send us, even if it's in note form, and we'll convert it into a blog to go on our website. That's it. Thank you, everybody. Especially thank you to Christina and to Lucas and to our speakers. Stay safe, stay well, stay sane, stay in touch, and see you next week if you speak Spanish.
Thanks,
Bye.
everybody.